March is Endometriosis Awareness Month. The number of women that come to me and have a diagnosis with endometriosis and haven't had it explained to them, or they're experiencing a lot of the symptoms without knowing about the diagnosis. I thought it was a great opportunity for us to share what it is and different things that you can do to help yourself and get into remission for it. Endometriosis, it's not something that you can cure, but we can definitely get you into a remission and in a comfortable state for the foreseeable for you. So, endometriosis, a uterus has a lining inside it called the endometrium. And what endometriosis is when these cells are in the wrong place. So, you will still have them inside, but they can be anywhere else on the body. Most commonly, because they are attracted to estrogen, most commonly they'll attract around the ovaries, around the womb, the fallopian tubes, but they're also inside the pelvis. You can get them even in your lungs. They can go absolutely anywhere. 1 in 10 women experience or suffer from endometriosis, but still now it does take an average of 7 years to be diagnosed with it. In the UK, we are working on this, and there is a brilliant charity called Endometriosis UK, which has fought for us to be heard in the House of Commons. So that's all been going on this year with debates on extra support for women that are going through these symptoms. Symptoms include very heavy periods, pelvic pain, hip pain, fatigue. But the most important thing to be aware of is that it does not discriminate. It doesn't matter what race you are, what nationality you are, anyone with a uterus can experience this. And like I said, over 10% of women have this. So things that we can do about it. My name is Laura the Acupuncturist. I'm an acupuncturist and herbalist based in Birmingham. And I'd like to pass you on now to another experienced acupuncturist to explain how we can help you.
Yes, so my name is Silène Brisset. I'm an acupuncturist in Clapham. And yes, you said it rightly. I mean, I was about to say that in France, it takes 7 years to diagnose an endometriosis. So it's exactly like in England, we're on the same vein there. And why? Because first of all, I think because it's still natural to think that periods are painful. So women go to their GPs and they're going to tell them what they experience, especially with endometriosis. It's not always, I mean, there is often a huge pain, but they are over pains because you've explained it very well. It can go everywhere in the body. So you can have neck pain. You can feel pain everywhere in your body on the luteal phase, and especially around the period. So it's very misunderstood and very misunderstood by the GP. The second thing as well that I found is very, very problematic. It's problematic on the endometriosis, but also on fertility in general, is that women are told, okay, we're going to check and we're going to do a scan. And this scan is often a 2D scans, and women don't know that actually there are different type of scan, and also there are different sonographers. So when they are sent to a hospital to be checked, often is a 2D scan, and with a sonographer who one day is going to check a liver, the other day a kidney, the other day a pelvic, the other day a lungs. And it means that they won't really check really for inflammation, but often whether there is a tumor or not. Let's face it. So often what I have is people coming to me with massive pain, with really big symptoms. And I ask them, have you been checked for endometriosis? And they say yes. And actually at the end, they were not checked at all, because a 2D scan cannot check if you have endometriosis. So you need to go to a sonographer that that is specialized, first of all, and two, who has 3D scan or MRI, or go to your GP and say, I want to have an MRI. And women need to really self-advocate. But to self-advocate, you need to know. And that's where there is a big gap. So yes, and then they, when they are diagnosed, it takes a long time for them through the NHS to have surgery. So there is a big gap there. And also there is a surgery for the pelvic, but often when they have problems again all over their body, it's very hard to deal with. So in TCM, we see endometriosis as blood stasis, so stagnation of blood, stagnation of chi, and stagnation of energy. And I often look at it as, okay, I check what is the source. What is the source? Because we all have more or less, our body can go in different ways, but we always have triggers, right? And the triggers can be diet. Basically, the question is inflammation, why your body is so inflamed. And that can be with your lifestyle, it can be with your diet. But to me, I think that stagnation can also be what's going on in your life. The stagnation that you're going through at the moment, it can be stagnation at work, it can be stagnation at home. And I always do, in traditional Chinese medicine, we really learn that spirit, body, soul is very much one, and you can't differentiate those. You need to see that the body and the mind are very much together. And if you have stagnation in your life, you really can feel stagnation in your body. And that's very much how I work, actually, whether it's endometriosis or any other illness. I found that the stress, the trauma, feeling stuck can really have an impact on what you live. So how I treat it is, of course, acupuncture, because it's what we say, we try to break the blood, to break this cycle of stagnation. Personally, I also treat it with Reiki and with womb massage. It's basically a massage on the belly. So we try to really bring the blood flow within the pelvic area and within the body. And underneath, we need to look at the source of the problem. So stress, how you eat, how you feel, sometimes self-belief, and sometimes trauma. Yeah. What about you? So how do you treat it, Laura? And I know that you're herbalist, so I'm sure you use your herbs, don't you, with your acupuncture?
Yeah, absolutely. So I also use acupuncture, and I find that weekly treatments, the 3 cycles, is about what it takes to get the person into a good position. As most people work and most people have busy lives, I find that once a week is about the maximum that they can get out of it. So adding herbs is an extra benefit because it's something that they're able to do every day, and it complements the acupuncture and it tops it up. So rather than them feeling the benefits grow with the acupuncture treatments, it just speeds things along a little bit for them. And like you said, with blood stasis, chi stagnation, again, that's what the herbs do. They break that blood up, they move it back into the lymphatic system to break everything down. And depending on what the diagnosis is, so as TCM practitioners, we have a very different diagnostic system to what we're used to in the West. So you can also get things like cold in the uterus, which is a very constrictive feeling, similarly to if you get a chill on the back of your neck, that sort of almost sharp feeling. So there's some great warming herbs that we'd use for that, like something like cinnamon, rogueway in Mandarin, that's called. And we'd use rogueway as part of a complex, individualized prescription for the person to warm up the uterus. Um, Also, on the opposite side of it, if there's a lot of heat signs and a lot of inflammation, and heat signs can be things like smelly wee or yellow discharge. If there's a lot of heat signs present, then we'd use cooling herbs to cool down the uterus. These like warming and cooling herbs, they're not going to send it into the opposite direction. They just get it into a nice neutral picture. Um, Something that I do need to say about the herbs, though, is that it's not suitable for all people, depending on if you're on prescribed medications or some over the counter medicines as well. So it's vital that you see a professional herbalist and you ensure that they're well aware of the medications that you take either regularly or, you know, if you're going to pop a pill if you're having a flare, that they're aware so that they can make sure that whatever herbs you're prescribed are 100% safe for you. And they go through a lot of training, and there's a lot of research into Western medicine alongside TCM medicine to make sure that it is safe for you. So that's the main things about herbs. Is there anything else that you do on top of the acupuncture and Reiki? Is there any foods, lifestyle advice, exercises, breathing techniques that you'd recommend to your patients?
I was about to say, actually, I forgot to mention castor oil pack. I think that castor oil pack is fantastic when you have any pain. With regards to diet, lifestyle, it really depends on the person. Actually, it's really one to one, and that's the beauty of our job, is actually to see the person as it's very holistic, and we see a person as just one. So for diet, you can have women who don't do well with tomatoes or aubergines or nuts, and some of us it will be with something else, you know, with the gluten, dairy. But everybody is very different, and I'm very wary actually now to really talk broadly about diet. I really think that diet really depends on the individual, and everybody is very, very different. With regard to mindset, I think for me, what is important is I was saying about stagnation. Are you stagnated in your life?
Mm.
Do you feel stagnated? Do you feel stuck? And I really like to ask these questions because, as I said, you know, stagnation in your body is often a reflection of a stagnation in what's going on in your life. And with regard to exercise, it really, really depends on the person again. Some people will do really well with, you know, quite a good, you know, healthy exercise, like pumped up exercise, but others would really need to have, you know, lots of walking, lots of yoga. But again, it really depends on the person and what they live and what they really need. So that's why it has to be very personalized.
That's great. Great answer. Um, so I'll just share briefly my experience with endometriosis, and then I'll ask you if you've got any success stories or anything that stands out to you about it. Um, I have diagnosis. I have endometriosis myself. I've been experiencing it for about 5 years now, and I will say that on my own success story, of course, I treat so many women that come in with endometriosis and adenomyosis, which is similar-ish. Um, but it takes a lot to be heard by the GP. So it took me 4 years. You need to advocate for yourself. Sometimes, as much as it pains me to say, sometimes you need to take a male in with you to actually be heard, and that's what I had to do twice. Make sure that it was dismissed as, oh, you stressed, and I'm quite a laid back person. It's not. I don't feel that stress can cause that level of pain in a person.
Mm.
But anyway, since I've graduated as a herbalist, I pretty much constantly. I will take maybe three months worth of herbs, and that will be enough for me for maybe 6 months to be out of pain. And like I say, it is being in remission. So it is something that can come back, and it's very difficult to actually resolve completely. But for me, having 6, 9 months pain free is fantastic. I get my life back, I get my energy levels back, digestion improves, mood, of course, because you're not in chronic pain. So, as a sort of success story, I feel that I'm one of my own, that
Yeah.
I'm to share the story of, because some individuals that come for treatment, they don't they're not comfortable with having their story shared. Some are, um, but yeah, that's my personal experience. And yeah, advocate for yourself. Um, MRI is fantastic, isn't it? As a diagnostic tool. And currently, over 750,000 women in the UK are on the NHS waiting list to see a gynecologist. So that just shows how long the wait time is at the moment. So if you can see an alternative, or a holistic or a supportive, integrative, whatever you want to call us, come and see us, because it really does.
Yeah. Yeah.
Any success stories or any stories?
Yeah, I remember a lady who was very much in pain, and in fact, I remember she came, and we had a few sessions before her next appointment, and when before her next period, and the next period she experienced was even worse than she ever had. And I thought, yeah, but that's something that I experience a lot actually with endometriosis. Is the first period after we treat it is actually quite dramatic, and then it gets a lot better. So remembering, I remember, I treated 4 or 5 months, maybe 6 months, and and um, and then I didn't see her for a month, and she came back and she said that she was feeling so much better. She was doing a lot of castor oil pack. I asked her to do castor oil pack 3 times a week. And also there was situation in her life where she was very much stuck, and she was dealing with it at the same time. um, yeah, I remember something very personal was there and was really problematic. And anyway, it's very hard to know what is and what is not, right? But I like to think that everything is has there is a bit of a mix up, in everything. And yeah, she felt so much better after.
Brilliant. That's great. So that's how we can help. Some take home things that they can do themselves, as you said, is the castor oil packs.
Yeah.
Epsom salt baths, warmth is usually great, isn't it? Glutathione. Have you come across glutathione, or do you work with it?
Yeah, I mean, I'm not a nutritionist, so I would not ask women to do that, to take them. But yeah, I have, of course, yes.
Just personally, I found that it's
Yeah,
very
it's
um,
very positive. Yeah,
liquid version of glutathione. Um, and light exercise, like to get that stagnation moving, if they feel that they've got the energy to do it anyway.
yeah, fantastic. I think we've done the 360 degrees of our experience as therapists with endometriosis. Huh?
Yeah, fabulous. So
Yeah.
the um, the the management of it, you would expect to be working with somebody for what sort of duration?
Can be a very long time. I mean, I'm treating I've been treating a lady, for example, for endometriosis for the last 3 years. I am not saying that I see her every week. I don't. I see her regularly, like once a month. Now I used to treat her regularly. It's at bay. It doesn't there's not as many trigger as she used to have. She's not on the floor anymore when she has a period, but endometriosis is severe, and even after surgery, it can come back. So yeah. Mm.
Good work then with all your patients.
Yeah. All right.
Well, like we said, I'm Laura, known as Laura the acupuncturist.co.uk. If you're based in Birmingham and would like a free 15-minute discovery call with me or to book in your consultation.
And yes, I'm Silène Brisset, acupuncturist in London, in Clapham. And you can contact me at www.silenebrisset.com on my website. You've got all my details there.
All right, then all the best, Silène.
Thank you. All the best, Laura.